Well, new data likely to ignite the healthcare debate. A new report says that companies are raising the share of a worker's cost for health insurance at a sharply higher rate.
The Kaiser Family Foundation that did the study says employees paid an average of about $4,000 toward their family coverage this year, a steep 14% jump from last year. Our next guest says this report marks the start of what he calls a, quote, death spiral for employees and their coverage. We are pleased to have back Dr. Sridhar Pattarazu. He's CEO of Vital Spring Technologies, both a doctor and a businessman. Good to have you once again, doctor. Thank you for being here.
Good to be back. Thank you.
Death spiral? That seems very dramatic. Tell me why you say that, because there are a lot of people out there who say, whoever thought of having employers shoulder the entire cost of an employee's health care in the first place?
Well, here's my concern, Liz, because first of all, this survey was done even before the law came out. So this is the tip of the iceberg. If that's how employers felt before we ever put in place the law, imagine if we redid that survey today. The last time we tried to push that much cost back to employees several years ago, the employees of GE and Verizon and everybody went on strike. And the minute you start adjusting these kinds of financial incentives with consumers by raising the co-payments or their deductibles, they do a couple of things. Either they stop seeing doctors or they end up going to emergency rooms for their primary care, and that jacks up the cost of health care enormously.
And they don't get the care that they need. Exactly. But, you know,
they don't get the care that they need, right?
I was looking at the study, and only 48% of those that work in retail firms had health insurance at all. And then if you look at manufacturing, you look at other industries, it was much higher. But are we going to see, do you think, because of the new health care law, are we going to see a further decrease, in particular in the retail industry, when it comes to coverage overall?
Well, you can. I mean, the numbers are already low. I mean, 48% in the retail industry is a low number. And then on top of that, what retail employee is going to necessarily want to take on the burden in their low-wage salary today of a higher deductible? They've got a couple of options. Either they don't get any coverage at all, and then they have to go into the exchange that's going to be set up in the next couple of years. The exchange isn't going to be any cheaper, even though they're going to be able to get insurance. So we're going to still see a lot of people out there who aren't going to have the right coverage, and they're not going to be able to keep the right doctors, because the other thing is insurance companies are starting to narrow the networks of the doctors they're willing to pay or accept.
Well, just
which
by the way,
means that
we just showed a board of the insurers. Most of them are up more than 2%, so clearly they're not suffering at all. Doctor, isn't this increased cost shifting from the employer to the employee just an extension of a trend that we've seen for years now, not just under this administration, but past administrations, that for quite some time now, employers have been saying, I can't afford to shoulder that much cost of an employee's health care?
We keep going through these cycles over and over again, Liz. You're absolutely right. And every time the employers are backed into a corner, the knee-jerk response is shift costs back to the employees until we can figure out what to do. And what they're trying to figure out now is how much they're going to have to keep in terms of benefit to not have to pay the penalty versus whether people are going to go into the exchange or not. They've got a really fine line to walk here, which is a real challenge. And so the first thing they're going to do is to shift costs, because they're not getting any other tax breaks right now. And, you know, we're hearing some suggestions of maybe a payroll tax break that's rumbling here in D.C.
Right.
You know, who knows? But it's a really tough situation for them.
Dr. Sridhar Pattarazu, certainly this is going to be a story that we're going to continue to follow. Thank you, sir, very much.